There are some very special people in this world who truly make a difference through their ongoing acts of kindness
and personal generosity. We'll introduce you to two of them on this week's Health Talk.
Stay tuned. We're up next.
Hello, I'm Dr. Eric Mazer.
And I'm Dr. Vicki Smetak. Today we are going to talk to two very inspiring volunteers. Joining us now is Fred Lione, president of the Norwalk Hospital Volunteers, and Mark Gentilozzi, a volunteer at Norwalk Hospital.
Well, in Health Talk, gentlemen, this is the first time for both of you, isn't it not?
It is.
It is.
You're volunteers at Norwalk Hospital. We see you all the time. And Fred, I'm really interested in exploring what prompted you to become a volunteer. I know, Fred, you have a pretty dramatic story. So tell us, what prompted you to join us in the Norwalk Hospital family?
Well, back in March 27th of 1993, I flatlined in an ambulance on my way to Norwalk Hospital. I was paddled back in front of Blockbuster and brought into the emergency room and told I had a very serious heart attack, told that TPA would resolve
That's
the
a
issue.
clot-busting drug. I know
Yeah.
you're familiar with it, but a lot of
Right, I remember
probably
Genentech developed it. I knew
Right.
it for that reason. And I agreed
Did you
with that.
invest in it?
No, I didn't, unfortunately, but it did save my life. They said that if I hadn't used it, or didn't agree to using it, that I would have very serious heart muscle damage, which is irrecoverable, as I found out. So I said yes, and it worked. I spent 5 days in the CCU in Norwalk Hospital, and then went into the telemetry, and then up to St. Vincent's for the angioplasty, because at that time Norwalk Hospital couldn't do the angioplasty, and came back. And I realized, here we are many years later, after I retired, that a lot of people took care of me and did a lot to make my stay better, and I thought I'd try to do my best for it. So it'll be 7 years in April that I signed up for this job.
What an
And
inspiring
now you're president
story.
of the volunteers.
Yes,
Yeah.
yes.
Now, I thought I read in my notes, Fred, that you actually volunteer with your wife. Is that right? Does she also volunteer at the hospital?
Yes, she does.
Yeah.
She's part of
What
the
does she
flower
do?
program, which runs on Tuesdays and Fridays. And she does the arranging. I do the distributing, along with a woman named Levon Kramer, who started the program.
Yep.
And got wonderful response. I get all the credit because, of course, I visit all the rooms with these wonderful flowers.
And your wife does all the work. Well, that's,
She does all
that's
the
how
work.
it works in my house.
I don't think our house is much
Mark.
different.
Said from the person on the other side. Mark, how about you?
About 30 years ago, approximately 30 years ago, Norwalk Hospital gave me my first job out of college. And I thought at the time, if I ever had the opportunity, I would love to come back and spend some time volunteering, because that was one of the departments that I had not worked for, but was one of the departments that I had spent time with as a software analyst. So,
Yeah, so you were really ahead of your time. Let's place ourselves back 30 years. That was in the early
80s. Yes, in the early 80s, yes.
And computers were not a big part of medicine then, although I know Norwalk had some
They were
pretty
on the
advanced
forefront,
stuff.
yes.
But so you worked with those folks back then?
I did, and the other reason was my mother battled cancer for many years, and not at this hospital. And my oldest brother, also died of a terminal disease. And there was a lot of nice people in the healthcare facilities that they were at that took care of them. And it was important for me to kind of come back and work in the hospital and be part of that environment and do whatever I could do to be helpful and spend time with patients and just talk with them and be helpful.
And it sounds as though you've actually inspired another family member, as we were talking about earlier, your daughter, who's interested, right? Tell us a little bit about that.
My youngest daughter, she's a senior in college, and as part of an internship program, more in the community relations department was let her come in and be helpful, working on projects there. And I was hopeful that sometime later on down the road that she'll continue to be a volunteer, and maybe this is just the start of it.
Yeah.
And then I guess there's a lot of word of mouth that gets other volunteers into the hospital. I do know that Norwalk has, I think, the largest volunteer program in the state of Connecticut.
That's my understanding.
Which I think is pretty remarkable, because we really are considered a very medium-sized hospital, and yet to have the largest program. Why do you think that is, Fred? You're the head of the volunteers.
Well,
I just think it says something about our community.
I do too, and I think Norwalk has retained the hometown feel that it always had. And the hospital, being a community hospital started by these women back in the 20s, as I understand it, sustains through this time. I mean, so many cities around us gotten much larger, people from outside, that you don't feel the community involvement that you do at Norwalk. We have over 450 volunteers doing all kinds of things.
It really changes the feel of the hospital. I'm sorry, you were going to say.
I was just going to say, if I could add to that, as being a volunteer now, I can see why people stay on. It's a very enjoyable thing to do. There's so much that you get out of it as opposed to the time that you spend there. So there's no really, I can see the longevity. There's people there 40, 50 years volunteering. Hopefully I'll be there.
Tell us more about that. What you volunteer in part to give something back. I mean, you both have medical experiences, personal experiences that you're sort of repaying, although it doesn't require repayment. But I think there's something that one gets out of volunteering inherently for yourself. Tell us more about that, Mark.
Well, I love the fact that I get to enjoy the volunteers themselves. Listening to Fred tell stories, I could sit there and listen all day to that. The group of in the transport that I work with, they're just fascinating people. Many of them are 20 years my senior, and just to sit and listen to their stories from the past is just, I just enjoy it. My mother and my father died at a fairly young age, and I kind of live, vicariously through them, or listen to their stories that I didn't have a chance with my parents. So it's a wonderful experience, I find.
Well, I do telemetry 9 West, and
what does that mean when you say you do telemetry 9 West?
There's a program called the Ambassador Program, which is kind of feel the temperature of the patients, and hopefully they're having a good experience, and if they're not, find out why that isn't so. So every Tuesday now for almost 7 years, it'll be 7 years in April, I go to 9 West with my little chart of the patients, and I visit each room and each patient and ask how things are doing. For the most part, I'm happy to report things are other than the fact that they're in a hospital and would just as soon be home, obviously. The care has been terrific. One of the biggest improvements over the last few months has been the new food service.
Yes.
It used to be, and I'm not sure the details of it, but it used to be, we all been in the hospital, you got breakfast, lunch, and dinner. Now they have a menu, and if you want a 2 over easy with bacon at 10 a.m., assuming your doctor allows you to do that, you can have it. So people are extremely happy with that. I've begged the question on that for the last 3 months just to see how successful it's been, just my own information. And it's been tremendously successful.
Do you find that patients are usually happy to see you when you knock on a door? What's the response you typically get?
There are all kinds, because folks are all kinds. I find older people, particularly older men, relate to me because I'm of their generation.
Right.
And also I was born in Stamford and have lived in Norwalk since '81, so I know the area, and if they're, quote, townies, we have a basis to discuss things, But most people are very responsive and receptive. Occasionally you get someone who just doesn't want to be bothered, and we just back away from that and leave them. Often family members are in the room. Very often Hispanic speakers.
Yeah.
The patient themselves, an older person, doesn't speak English. The daughter-in-law, the son, the grandson are there.
Do we have Spanish-speaking volunteers that are able to go into the rooms?
I can't answer that. I'm sure we do, but not in any great number. But we have that the translation line, and I've used it for an Indian woman to see, because it was, you dial the magic number and tell them what you want, and in an instant somebody from somewhere is on the phone answering in the language of the person you're visiting and want to ask questions of.
And how about you, Mark? You said you do transporter?
Yes.
Tell us what that means.
We assist people whether they're coming into the hospital or if they're leaving the hospital, usually from ambulatory surgery or being discharged from one of the patient care floors. But anybody who needs assistance, it could be a visitor coming to see a family member. If they're having difficulties, we help them get up to wherever they're going. If they're going to one of the doctor's offices within the hospital, assist them. And that's primarily what we do, and that's done 5 days a week by
And how often do you come in?
I volunteer twice a week from 12 to 3 every week, and also at the end of the month we have a book sale that I work at, and that's from early in the morning till late afternoon.
It's right off the lobby. I see that all the time.
It is right off the lobby. It's a wonderful way to raise funds for the hospital through the volunteer department, used, and sometimes new books. Great program.
Yeah. What an enhancement to the patient experience.
Oh.
I mean, coming into the hospital and, like you said, you walk into a room, the person there in an ideal situation relates to you, they can talk a little bit. Obviously, everybody in healthcare is busy these days. We go into a room, we leave a room, but to have somebody like a volunteer who can go in and spend that extra time really is so meaningful to our patients, I'm sure.
And so Mark, you're one of the younger volunteers, newer volunteers. What surprises, as someone who hasn't worked, Vicki and I worked in hospitals really our whole adult lives. What surprises do you think, what did you learn about hospitals, doctors, and then I'll ask you that, but you've been around so long, those surprises may have been many years ago.
I think I have found that the caring attitude of everyone, it's much more genuine than I originally imagined, or sometimes maybe people don't think. There's just, you can see it in their eyes, you can see it. I find when a patient's leaving and they're saying goodbye to the staff on the floor, there's hugs, kiss goodbye, in a friendly way. We really don't want to see you here again. Hope to see you somewhere else. It makes you feel fantastic. And there really is a bond between the caregiver and the patient. That's what I find.
Yeah, and I will say that's not just Norwalk Hospital. I think largely those are healthcare providers. Most of us who go into this, either as nurses or doctors or technicians, go into it because we want to do something which helps other people. So I know a lot of people are suspicious of healthcare and they come in thinking somehow, and certainly we have our bad apples in the world of healthcare providers, but I think most people really do care and are here because they do.
I think so too, but again, to the bringing back that point of that community experience that I think in many ways is unique. Wouldn't you say? I mean, larger institutions do a wonderful job with cutting-edge treatments and advances and all that kind of medicine that's out there. But I think the community experience, we really do a good job of that at Norwalk.
Yeah, and I think that also that I'm at a community-based hospital because I think we can deliver the best and most personalized care for most disorders there. But Fred, how about you? What surprises do you think there were? What have you learned over the years?
I've learned how much volunteers are appreciated by the patients. Over and again. People, it seems to be 3 out of 5 every week will say, thank you for volunteering. Now, it's not just me, obviously. It's all of the volunteers.
Well, you
they
guys
appreciate. Go ahead.
I was going to say, you guys and gals have something that most of the providers don't have, and that's the time. Most of us are rushing from patient to patient, and you have the time to really engage.
Yeah, and if somebody wants to talk about the Twilight League baseball thing in Stamford 40 years ago, I have the time, and I've spoken for 10 or 15 minutes with an old duck like me who is talking about the Stamford Pioneers from 100 years ago, not really, but in the 40s and the 50s. Yes, we do have the time. We do have the time. And the rounds, sometimes they're more run quickly than others because the patients they're not well, they don't feel well. But other days it could take you hours to get around that floor because people are engaging and want to be engaged.
Well, that's all we have time for this segment, but we're going to have you both back for the next segment. We're going to continue this very interesting discussion from people who volunteer in healthcare and sort of the view from the other side. So we'll be back after a short break.